Good afternoon, everybody. My name is Scott McGann with the Falmouth Health Department. It's July 31st, 2020, doing our weekly COVID-19 update. Phone number for the Health Department is 508-495-7485. health@falmouthma.gov is our email, and the website is falmouthmass.us. So as of today, there's 231 cases of COVID-19 been confirmed in Falmouth since the beginning of the outbreak, which for us was March 19th. The confirmed case represents an individual who has received a positive molecular, otherwise known as a PCR test result. There's been 24 confirmed cases during the 14-day period from July 15th to July 2020. Most of them are associated with two recent clusters that have occurred, one at a long-term care center that I decided to mention later in my presentation last week, and social activities that you've seen on TV resulting in the application of cases. So those two activities have met most of the 24 confirmed cases, and we still are getting sort of random cases here and there at a pace of give or take 5 a week or so. So we still do get some of those cases, but these last jump was mainly because of these two activities. About 88% of all cases are no longer in isolation. As we've had some new cases, the total that aren't in isolation, that percentage is going down. If you've listened to my presentations before, that number was up as high as 98% about a month ago. But as we've had some new cases, they take a little while to get out of isolation. So that's where roughly our percentage is right now. We're still about a little over 13, almost 13.5% of all cases in Barnstable County. Highest we've ever was 23% in early April. Our expectations to be somewhere around 14% if there was an even distribution of cases. The VNA and the state CTC will, with the support of course, the Health Department, continue to do the isolation and contact tracing as needed on each case. So looking at the charts that I do every week, you can see that we're doing really well in the sort of June to early July, at less than, generally less than around 5 or less a week. In our long-term care, and then recent activities that you see in the press with the lifeguards and the beach department cases that have occurred, that you see a bit of a spike there. It's still within the realm of what we were seeing in May, and hopefully we can keep it sort of down, and that's kind of where we're at with our local weekly case trend. Second chart, you can see where we're going up at the end. Hopefully we can flatten that back out. As you can see, in sort of the March, April, we're hitting cases fast and furious. Then we've leveled out, and then back around mid-May, you see another little peak. That peak was from long-term care. We had a couple long-term care incidences. Then we flattened it back out, and then we've had a couple of clusters occur again, and that's where that sort of is occurring again. So that's where the numbers bear out from our past 14 days. As far as the state dashboard, again, you can get this updated daily at the state's COVID website. So I'm just going to go over it with you. The newly confirmed cases, 304. The last couple of days, it's been over 300. There has been some technical reporting errors in one of the hospitals. I don't know if that necessarily means that these numbers are artificially high, but they are higher than the 150 to 170 that we were getting a couple of weeks ago. The death rate is 15 from yesterday. Total confirmed cases now 109,400 with a total death of 8,375. And we're averaging between 10 and 15,000 tests per day. We're over 1.5 total molecular administered tests. The trends still remain in the green for positive test rate, hospitalization, testing capacity, and in progress on the other measures that we use to see what phase we're going to be in and see how we're doing. This is a little bit of an old slide, but the state was 1.7 positive at the time. The county was at 1.0 as of 7/13. This has not been updated at the county site. I did leave it in there. It shows that Barnstable County has been doing better, though the cases are, we have a lot more people here at Barnstable County right now, so it lends itself, and plus, and with travel, that we lends ourselves that we would have, our numbers would go up, but as long as we can stay below the state, that's what I'm hoping for. From the county, you can see that our total case average went down really well in early June, all the way till about the mid-July, and you can start seeing it from the 18th, that you start seeing a higher rate, a higher number of cases on a daily basis than what we were getting earlier. And again, we have a lot more people here, a lot more travelers, and things that can go wrong as the more people that you have. And maybe also a little bit of complacency with mask wearing, social distancing, gatherings, and so forth. that lends itself to have an increase, and hopefully that we can keep it flat and we can get back into diligence so that these numbers don't spike up like they can really quickly, and we end up back to where these numbers were in the April into May. State indicators, you can see the percent positive in July was 1.7 in mid-July, July 11th through the 14th. Now we're up to 2. We definitely need to keep that number below 2, definitely below 3, but you can see a bit of an increase. And I'm not sure if that is a trend yet. It's a little early, but it does appear that we do see a little bit of an uptick in the percent positive, which I've been telling you all along is an important number. Our hospitalizations, since we're lowest at July 27th, the 20th, and 29th, has seen a slight increase. Hopefully that's not a trend we'd like to see, and hopefully it's just not enough of a trend to tell me that it's consistent, but you can see a little bit there. Surge capacity has been up and down, staying less than between 5 and 0. And our deaths went up a little bit earlier in the week and down a little bit up to the 27th. County, you can see the county line is the light blue line. You can start seeing it ticking up a little bit here, kind of like what you saw with Dukes and Nantucket, the purple and the green at the bottom, a little bit of a rise. They've seemed to flatten it out. So I can see a slight rise, and like you've seen in Falmouth, you see a slight, you see an uptick in here. And so, we need to keep our eye on that and continue with our diligence. I gave you, this is the, last week up top is what I gave you, is, when we were looking at Falmouth, that you saw that we had a low incident rate, so we're a lighter color purple, and we were testing at a high rate, which is good. If you're testing at a high rate and not finding it, that's a good sign. You flip it to this week, because we've had some positives, again, at the long-term care, because this is done on Wednesdays. The long-term care case number that I gave you last week, that's why we had 222 last week, so I included the cases, but it hadn't made it into the incident rates and the testing rates. So you can still see that on the right column. We're still testing at a high rate, very high rate for other towns, which is good, but our incidence rate is ticked up. So our rate per 100,000 is now into the darker blue, and indicating mainly of the two issues that we've had over the last 10 days or so. Again, on 7/22, we had a case count of 208, that our total count was less than 5 over 14 days, and our percent positivity was 0.37%. And now we're at 229. This was Wednesday's data. 22 in the last 14 days, last count, with an increase in a positivity rate of 2.37%. And now we're higher this week in average than the state, and this is the first time that's happened since I started to track this maybe 2 months ago or so at least, that we're above the state at the 1.74 of the 2.37. Again, long-term care, the recent events that you've seen on TV regarding lifeguards and things, and also, we still are getting some cases during what I call random or one-off, or not necessarily related to any particular cluster cases. So hopefully this is an anomaly that we can get back onto the 1%. I liked it. We were at 0.62 the previous week, 0.37, in a great trend, and now we've picked up to 2.37% positivity rate. State numbers again, down as far as hospitalizations at 367. We're down 455 from June 26, but up 16 from the previous week. Cape Cod and Falmouth Hospital seem to be doing well. Cape Cod Hospital has 2 hospitalized, 1 in the ICU. Falmouth Hospital has 0 and 0 for the last few days. So that's an indicator that the infections that have been occurring have not resulted in the need to be hospitalized at this point. Hopefully, that we continue that. Daily and cumulative intubations, we're down 111 intubations, down to 50. ICU people in ICU down to 59 in the state. That's down 111 from June 26, but up 4 from July 22nd. Count of cases currently intubated, down 72 from June 26th, and down 1 from July 22nd. So they're still relatively flat with a slight uptick, and we just hope that continues to be on a downward trend. Our long-term care cases, we've had the recent ones show up in here. The death rate based among long-term care has been pretty steady at around 65% of all deaths have been associated with long-term care, 5,000 out of the 8,000 plus deaths. Most of our nursing homes are doing well. The one nursing home that we continue to work with has not had new cases since that first report that I gave you last week. As far as testing, drive-through testing, this is drive-through testing for the PCR test, and I have a new slide to show you the difference in a second. The drive-through testing is now located at Falmouth Hospital by appointment. There is a bit of a lag due to lack of supplies and an increase in just the increase in people that want tests. If I go back a couple of slides, I meant to mention this before, total number of tests last 14 days, we're averaging over 1,000, we're averaging over 500 tests a week. Okay, so that's just Falmouth. That's a lot of tests. And, you tax the system. So there is a bit of a lag with these, with using the PCR test. Too far, but, right now that's what we're at. But the gold standard testing is the PCR, like I'll talk about in a minute. You can get that at either the drive-through at Barnstable. I don't think they've transitioned to Cape Cod Community College, at least I haven't been notified of that. And also you can do it over here at the hospital. You'll need a doctor's note and schedule an appointment. The call center that your physician would use is the 508-862-5595. You can also get it at some pharmacies, the East Falmouth CVS. You get it at some walk-in clinics. A lot of people have been going to a walk-in clinic down Cape, in Dennis, I believe. There's walk-in clinics here at Falmouth that also do it. There's a pop-up testing sites in 8 cities. The closest one would be New Bedford. That's until mid-August. And you can also go on the mass.gov COVID-19 testing. A little bit about COVID testing as we learn as we go. And so up until last week, you had the PCR. The PCR is where they actually detect viral DNA through a PCR test. It takes greater than 24 hours. I would say the average is around 72. It shows you that you have a current or an active infection, or you just had it so recently that you still have some dead viral particles in there in DNA. And this is the only way to be considered a confirmed case in mass under Mass DPH. So it's the PCR. The antibody test tells you that you've got antibodies. This means that you've been infected sometime in the past. You may not have been able to get a test back in February when you had COVID-like symptoms. You could take an antibody test now. Shows past infections. It's rapid. And the antibody, sorry, I spelled that incorrectly. I just finished the slide. And Mass DPH considers this a probable case. What's popping up now is these antigen testing, which detects antigens made by antibodies indicating a current or past infection. It is a rapid test. The state has determined that false negatives are sometimes up to 30%, so the accuracy isn't quite there, and that's probably why that the Mass DPH is considered in this also a probable. So those aren't considered confirmed. The state said today on a conference call that they would still recommend people get the PCR test if they do test positive for the antigen test. That it's a good rapid test method, but the accuracy just isn't there. And so, and some of the problems that we've had is that people are being tested, individuals are getting results at the location, but they're not necessarily making it into the formal MAVEN tracking system that we use at the state, that the towns get, and the VNA and health departments and the CTC use to track quarantine and isolating and go through that sort of procedure. That the antigen test is giving results way before they would get imported. And that's a problem that needs to be taken care of. The state is aware of, the submission of these results by the individual places that do the antigen test. They need to come into us quickly. Also, the inaccuracy of the antigen test itself, so that the state is working on that. So, that's where it was sort of a new wrinkle from last week. These things pop in and, test methods, but they don't necessarily, they sort of slip the state, and the state doesn't mention it to us, and then here, us at the local level, are seeing calls of cases that we're not actually seeing in MAVEN, which makes things very difficult for me. So, and for the VNA, and for everybody else who's trying to do the contact tracing. So, again, the PCR is the gold standard, and that's what's being done. That's the nasal swab that goes way up into your nose, and that is done, and that is the preferred method. The problem with it is it's the timing, it's getting a test, it's getting the time it takes to get the results. Because you should be quarantining pending your results. It's the reason why you got tested. We shouldn't be going around doing whatever, waiting for that result. So it is frustrating. Hopefully it does get better. But that's kind of where we are at the state of testing right now. Again, we're in phase 3, step 1. The slides have remained for a couple of weeks. So you do see some indoor restaurants, some indoor activity. Gyms are allowed with some limited occupancy. There's gatherings indoors of 8 per 1,000 square feet, up to 25 in a single space. And we've been in this. There's no indication that we're going to get beyond the phase 3, step 1. Okay, so that's kind of where we're at. Social distancing and face coverings. The complaints still are rolling in. We are following up with as many as we can. We need to continue diligent with the social distance and face coverings, the hand washing and the hand sanitizing. Also, the quarantining upon arrival. You know, our infection rate was pretty darn close to negligible recently. And as people move, people go places, come back, or visit here, the quarantining is important because that's where you tend to get the first case starts that way. And then, you know, someone's working with somebody, or somebody, you know, goes to a gathering with someone, and all of a sudden now you've got 10 or 20 or plus. And beyond that, whatever happened last week, then you get concerned about parties that might have happened the following weekend while people were either asymptomatic spreaders or hadn't been tested yet. So then you end up having this whole snowball effect, and that's really what we don't want. So by following the guidance, you know, and not having large gatherings, especially indoors without social distancing, and limiting those types of things, and quarantining as you're supposed to, those will help greatly keep the counts down. The lack of doing that, yeah, you can have, you know, let's say, I don't know how many in Falmouth we have in a given week, but let's say we have, you know, 100 gatherings. It only takes one gathering where, you know, somebody who is asymptomatic or not ends up having a spreading event. And that's what we're trying to avoid. Then we end up with clusters, you end up with high case counts, and then it takes a while to sort of quell it. Now, we just hope that doesn't occur with us, but that's kind of what happens. So we really want to make sure that people are still maintaining the social distancing and the diligence with face coverings and so forth. The other things are staying home when ill, not going to work, not coming to going places if you feel the symptoms. Any of the state guidance, it's on there. It's a little cumbersome, but you know, if you're a business, follow the state guidance. I mean, we all need to sort of get back into it, as hard as it is. Trust me, I understand. I live here too. You know, we're all in the same boat, so to speak. It's just really important. What we don't want to do is undo all that hard work that we did in, let's say, April into June, and we had, you know, an infection here and an infection there. We don't want to be living with 40 a week or 30 a week or any of that sort of number. So we just need to make sure we get back into it. I've got additional help to follow up on complaints now. The county's allowed me to have some extra help, and we continue to keep going after them. It is difficult sometimes because if it's a mass complaint, you know, it's hard to get to that exact same spot where you might have been, but we do follow up as many as possible. Another thing I wanted to mention is starting August 1st is new travel guidance from Mass requiring a 14-day quarantining and a form that's supposed to be filled out. You know, so that is emphasizing the need that we don't want to be bringing COVID back into places that had low infection rates. And so, and also it's got a lot to do with the timing of it, probably also has a lot to do with students coming back and so forth. So we want the new travel guidance, you know, to be followed, and we'll be sending that out to some of our local lodging places as well, if they don't have it already, just to make sure they have it. So to recap where we're at, the state metrics are a slight increase. I don't know if it's enough to panic yet or anything like that. I did notice that since we've gone into, you know, there's a 2-week or so delay in looking at when you go to another phase, the increases get unacceptable. I think that's still to be determined. Falmouth and cases are increased, which I would, you know, I guess if you look at it, it would make sense just because we have more people here, more people traveling. In Falmouth, particularly from 2 cluster events, we are getting random cases. Are they increasing? Maybe ever so slightly, but we're also testing a lot, so it's hard to say whether, you know, random sort of community spread is occurring above and beyond the 2 primary cluster events. Still be determined. And again, we're in current level in Massachusetts is phase 3, step 1. And again, I do these every week, and I hope that everybody follows the social distancing and masking guidance. And that's all I have for this week. Thanks.